Hey everybody, it's Dr. Sam. I received a question today about MS, multiple sclerosis, how it affects our eyes and vision. So MS is a disease of the myelin. Now the myelin is the outer layer of the nerves. It's a fatty tissue. So I think about this condition as a lipid dysfunction. So I want to bring in cholesterol because cholesterol helps make myelin. Now, I see the mechanism of MS go this way, that it starts off as an inflammatory process somewhere in the body. We create white blood cells, an immune response, as a way to deal with the inflammation. So the body brings plaque and cholesterol to the area to try to heal the myelin. So one of the reasons why we lose myelin is there's an impairment in the glucose production, and this affects our eyes and brain. Insulin resistance breaks down the myelin. This means that there's too much insulin in the blood. If you're under stress, you're going to have high cortisol levels produced from the adrenals, and this is going to elevate your insulin levels. My advice would be to go right on a ketogenic diet. Studies have shown that ketosis actually can reduce MS. You can work with your functional medicine doctor, learn more about the ketogenic diet, but it's a good one to go on if you've been diagnosed with multiple sclerosis. There's another approach I like. This is from a protocol from a physician, Dr. Cumbra, and he talks about increasing levels of vitamin D3. Now, if you're going to follow his protocol, there is a risk of increasing calcium levels in the blood. Studies have shown that if you have higher levels of vitamin D3, either through supplementation or exposure to the sun, you have a lower incidence of developing MS. There have also been studies where pregnant women who've been exposed to vitamin D3 either through sunlight or supplementation, their children have a lower risk of autoimmune disease and asthma. Think of vitamin D3 as an immune regulator. It influences over 3,000 genes in the body. And one of the ways to monitor the calcium levels in the blood is to do a blood test of the parathyroid gland before and during this vitamin D3 therapy. Now, this is a way for you to monitor the calcium levels in the blood. I would also include things like DHA, zinc, vitamin B2. Take magnesium, avoid dairy, and drink about 2.5 liters of water per day. MS can cause a diminishment in your vision, so it can create things like blurred vision, peripheral vision loss, double vision, problems with focusing and reading, difficulty with mobility, having vertigo, dizziness, problems with movement and gait, and experiencing jerky eye movements. So some things that I would suggest in addition to the systemic support would be some of my eye exercises. And there are two that I recommend. One is called the animal eye chart. It's an eye stretching exercise. When you stretch the eye muscles, you bring more hydration and oxygenation to the eye tissue area. The second one would be the yin yang peripheral vision exercise. This actually helps improve your peripheral vision and your visual coordination. And then I'm going to add one more, and that's color therapy. So if you look at green, blue-green, and blue 5 minutes a day, twice a day, this can bring better oxygenation to the retina, more health to the photoreceptors, and improve your peripheral vision. So I think there are many things you can do to neutralize the MS condition, and I want to thank you for the question.